Welcome back. Our next conversation is an incredibly important one because of the overarching need to ensure that our children every day are okay. Well before the pandemic and the last few months of social uprising, many of our children were suffering. And as we've already discussed this morning, things are worse now than they've ever been during most of our lives. We know that when children are exposed to traumatic events in highly stressed circumstances, their mental health suffers. So we want to ask, are the kids really all right? And what can we do about it if they aren't? Joining us for this critical conversation is Dr. Melissa Merrick. Melissa is president and CEO of Prevent Child Abuse America, the nation's oldest nonprofit organization dedicated to the primary prevention of child abuse and neglect. She has nearly 20 years of clinical, research, and leadership experience related to the etiology, course, and prevention of child abuse and neglect. Previously, Melissa was a senior epidemiologist at the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention in Atlanta, and served on a detail in the Office of the Commissioner at the Children's Bureau in the Administration for Children and Families. In partnership with the U.S. Department of Health and Human Services Office of Child Abuse and Neglect, she served as the lead scientist for the Adverse Childhood Experiences, or ACEs, study at CDC for 8 years. Dr. Merrick successfully leverages her clinical and research experiences to communicate and disseminate the critical public health importance of preventing early adversity to key stakeholders with diverse priorities, backgrounds, and knowledge, including legislators, business and civic leaders, and members of the academic and medical communities. Please join me in welcoming Dr. Melissa Merrick to our conference.
Oh, thank you, Paul. It's just so tremendous to be with you all today. Thanks for inviting me.
I'm just so glad you could be here, and we've got so much to dive into with you. But let's start. The name of your organization speaks for itself. So we started off today talking to Dr. Josh Gordon from NIMH about how MHA and NIMH are seeing spikes in depression, anxiety, and suicidal thoughts since this pandemic began. And as you know, children are feeling these effects most deeply. So it's so hard for everybody who is dealing with this. But when I think about being a child and doing it in an unsafe or neglectful home, over the last few months with all that's going on, what are you seeing?
Well, Paul, it's a tremendous question, but I think what we're seeing more than anything else is that prevention is more important now than ever. I mean, we know that parenting is challenging even in the best of times. So enter global pandemics, civil and racial unrest. Pair that with job loss or losses of wages, food insecurity, housing insecurity, childcare unavailability, or no access to health care. It is tremendously stressful time for parents. Myself, I have 2 young kids learning from home virtually. It has just been a whirlwind. But we know in this time of physical distancing and that we're seeing public health in action. It's like just like we all collectively have to wear a mask, right? If I wear a mask and my neighbor doesn't, it's not as effective. That is what we mean in child abuse prevention. Taking a public health approach means what we all do collectively to assure the health and well-being of all people, right? So that's the intentional integration of health equity into this work too, but it's really what we all can do together. So we can prevent child abuse and neglect if we stay in this time of physical distancing, if we stay emotionally and socially connected. We know that emotional and social support is such a protective factor to make sure that our kids have safe, stable, nurturing relationships and environments that can help them withstand this potentially very stressful and very trying time.
That's such a hopeful way to begin and the way to look at this. And don't let me take that measure of hope away when I jump to this next question. And because you've had decades, you're the expert in the work of ACEs, the Adverse Childhood Experiences. And we may have a number of people who are tuned into this live stream who may not be familiar with ACEs. So can you back us up a little bit and explain what that means and how adverse childhood experiences impact both health and mental health?
Absolutely. So the CDC defines adverse childhood experiences as potentially traumatic events that happen in the home under the age of 18. So these are things like physical, sexual, emotional abuse, physical and emotional neglect, and then various forms of household challenges like growing up in a home with untreated mental illness or an incarcerated parent, or substance use in the home, right? And no matter what study out there, and how they particularly operationalize ACEs or adverse childhood experiences, the bottom line is that they're super prevalent. So in any population, there's about 60% of folks that have at least an ACE score of 1, so at least one of those experiences. We know that if you have one of these experiences, you're likely to have more because we know these risks tend to co-occur in families. But we also know that as you add up ACEs, and so as you have more, it impacts your health and well-being more. So let me give you some examples. As your ACEs increase, so too does your risk of cardiovascular disease, the leading cause of death in America. So too does your risk for mental health problems like depression, anxiety, suicidal ideation, and suicidal attempts. So too does your risk for a whole host of negative health outcomes. In fact, a CDC vital signs that was released late last year found that we could potentially prevent 44% of adult depression if we did not have ACEs. So this is, we know that things that happen in childhood stay with us, both positive and negative. So really, for prevention to take hold, we want really to tip the scales with more of those safe, stable, nurturing relationships and environments that can really offset the impact conferred by ACEs. And obviously the ACE study and the collection of ACE studies in the literature are not the entire universe of ACEs that we know that our kids are experiencing right now in this country and abroad. And so I've even seen people use the name ACEs, that acronym, to say adverse community environments, right? The context, the disproportionality, oppression, discrimination, all of those environments that can exacerbate the impact of the individual experiences. I've also seen people use ACEs to say adverse colonial experiences, to really kind of invoke that historical trauma that we know get passed on to across generations. So really, at Prevent Child Abuse America, we are in the business of trying to stop early adversity like child abuse and neglect before it occurs, so that we can really set our children off on a trajectory toward health, well-being, and prosperity.
So are people talking about adverse COVID experiences as part of what kids are going through now?
Well, you just coined that new acronym, but they are talking about how COVID can be really, if not an ACE in and of itself, it's certainly an adverse experience for many families, right? We know that this time is super stressful for all families. Let's just start there. But we know, and your last speaker really got into it, I think, perfectly well, in terms of we know that not all people or communities are experiencing or able to weather this pandemic in the same way. So we know our Black, Brown, and Indigenous communities, our under-resourced communities, they're really feeling the heavy, heavy impact of COVID even more than others, right? So I think, we've seen models like the pair of ACEs model, which basically has sort of a tree graphic, if you will, and the leaves of the tree are what we typically measure about ACEs, but at the roots of the tree, those are the things that are really the contextual factors. So there, COVID very much can exacerbate the impact of early adversity.
I'm glad you've brought this up because, in the chat, I think a number of people have really been going back and forth and really, talking about a number of the experiences related to the experience of race and racism in America, and certainly it's a very real thing that we need to be understanding about in terms of our kids. And we're going to talk more about the impacts of racism over the next day and a half, but I'm wondering if maybe you can start us off a little bit here too. I want to tell you a story and kind of get your reaction to it. I recall that when I was a young legislator many years ago, many years ago, I was called in to mediate a situation in which a Black African professional was accused of physically abusing his 15-year-old daughter, which is right around the time that he and his family were planning to return to Africa after spending about a year here. Ultimately, they determined the accusation was unfounded, and his daughter surfaced it because she wanted to stay behind in the United States with her friends. So they let him return home with his family, including his daughter. But the local minister who called me in just couldn't believe how aggressive they were with him and how little the Child Protective Services folks at that time understood the differences between what they experienced and how he experiences life and the confusion that contributed to. I think many people still feel that Child Protective Services is still decades later more likely to intervene and intervene aggressively in families of color, and perhaps less likely to come down as hard on white families. Would you consider these to be fair assessments?
Absolutely. And they're repeatedly seen in every community in this country. I mean, this speaks to the implicit biases that exist in all of our systems. You're highlighting here maybe a healthcare sector system for, child abuse docs, or even the child welfare system that we know can substantiate cases in Black and brown families at a higher rate than in white families for the same presentation and clinical presentation. I think this, when you combine these implicit biases with systemic and historical racism and other systems of oppression, yes, we must have a narrative shift in this country. We still believe that, it's that bad mom or that bad parent or that poor parent who maltreats their kids, as opposed to we all have a role to play in assuring health and well-being of all children. And in fact, my children will do better and will thrive if all children and all families are doing better. So we really need to get to these root causes. This is our work. And I mean, the definition of public health from the Institute of Medicine in the early 90s is what we as a society do collectively to assure that everyone can be healthy. Okay, so it's not like trying to do something that's not in our purview, that's not in our discipline. It's what we must do. We must have a narrative shift. And, adding to your example too, it's the cultural competence too. It's the really, still othering people for their experiences. Oh, that's those people over there, versus all of our children, all of our families. How do we help support each other so that we can really achieve the highest level of health and life potential? It's really, we must get to the root causes of these problems.
Yeah, and when I was learning public health literally on the job as a public official decades ago, we were very good, I think, about getting an education about prevention, that a lot of people tend to focus in on those personal risk factors, they used to call them. So, and even now we see a lot of this. What can people do to help themselves? But at the root of these were these community risk factors that the public health people were trying to talk about and saying, we've got to fix the communities that people are living in before we blame people for the personal things that they do in reaction to what they've experienced in their communities. And I love it that you've got people focusing this way on, as I would say, the community risk factors as much as the personal risk factors here.
Absolutely. We must take a comprehensive public health approach. That means looking at individual risk and protection, of course, but also the community level ones, also the societal level ones, right? We're talking about a child living within a family, within a community, nested within a socio-political context, okay? So then our solutions then must be at each of these levels. We know that there have to be policy level solutions, okay? There have to be norms change solutions. Again, getting away from this kind of dominant narrative that it's a bad mom or a bad, single parent, a poor parent. No, it's all of us together. And then what are the assets in communities? Every community has assets. How do we lift up those strengths? How do we partner across sector to really promote child and family well-being? I mean, this is something that we must do. We must do better. I've heard so much in this time of, we can't wait to return to normal. I'm sorry, but we must do better than normal for our children and families.
Yeah, I think you're right about that. We've got to do better than normal, and I think this is one area where those of us who are parents of kids with serious mental health conditions have also known personally what it's like to experience the "you're a bad parent" syndrome. That's really part of the normal, part of the norm. We often say is to blame the parents. We blame the parents first, and then kind of make the parents prove that they're not bad parents before we go and look to some of these environmental factors that may be more present, and also biological and other factors that the parents in many instances may have had nothing to do with. So in your mind, what's the right balance to strike here? You've sort of been suggesting this and hinting at it as we're going along, but do you want another crack at just, exposing that a little more? In your mind, what's the right balance and how do we get there?
I think the right balance has to start with us making a commitment to strengthen families, to keep kids safe, that kids are safer in families than from their families. This is something that if families have more access to economic and social supports, they have paid family leave, they have child support subsidies, right, to help kind of take the edge off, to help them really commit to doing best by their children. If we have evidence-based home visitation, so support for new families upon the birth or adoption of a child, right, helping them cope with trauma, helping them practice these social skills, they're going to be better equipped to parent and engage in positive parenting strategies, right? But they have to learn what those are. We know the research that so much of child maltreatment, if your mom experienced child maltreatment, she or her children are more likely to experience child maltreatment in the next generation. So it's this dual or multi-generational approach to how do we strengthen families, keep them strong. That means keep them strongly connected to the community supports, right? To have a dominant narrative and norm in this country to support each other. I mean, this is what we mean by prevention, and certainly this is what we mean by primary prevention. Primary prevention is trying to stop child abuse and neglect before it occurs, not waiting for early identification of symptoms or of the presentation of child abuse and neglect. No, we want to help families before they find themselves in crisis. But this is really going to take a narrative shift. This is going to take all of us working together across sector to not just tack on the word prevention when we really mean treatment. Okay, and in full disclosure, I'm trained as a clinical psychologist, and I, like you, learned public health on the job, on the fly. But once you kind of learn about primary prevention, about, how do we stop this from occurring? And then, of course, yes, mitigate the negative outcomes for those who have experienced early adversity. But how about we invest in upstream prevention strategies more than we do, right? Why don't we tip the balance? Right now, we have billions of dollars that go into child protection and foster care, and only about $30 million that goes into prevention. What would happen if we took one of those $10 billion and moved them over to prevention, right? I mean, show me your budget. I know what your values are. So I think it's really about us all across sector recognizing that we all have a role to play, that prevention is possible. These kinds of experiences are not inevitable. It's not like, oh yeah, that's, violence is always going to happen in a home. Absolutely not. It's just so little support for families, so little support for keeping all families together and strong.
Yeah, and that's the key. I mean, supporting people, and I agree with you. I was just sitting here thinking when you're talking about primary prevention. Okay, there's some people who are into secondary and tertiary prevention, and none of this meant anything to me when I was, in the legislature, knew nothing about any of this stuff. I mean, for me, all prevention made sense as primary prevention. And, we have this, framing, the one thing I did frame was before stage 4, that we need to act before crises occur in the mental health space. I don't think it would ever have occurred to anybody to say we're going to prevent stage 4 cancer by beginning our intervention at stage 3. The idea was we were going to prevent it by preventing stage 1 from happening. And I think that's what you're talking about here, and that's what I talk about all the time too. And I hope it's resonating more with people. I think it is, don't you, that people are beginning to get more upstream perspectives. We've said, with Josh, maybe this is even a silver lining of the pandemic, that people are seeing what the really initial stages of stress and trauma and these adverse experiences mean to us, and how they tear at us.
Yeah, I hope so. I think that, we still have a long way to go in really operationalizing what we mean by primary prevention. And please don't anyone hear me say that secondary and tertiary prevention is not also important. It's a both and. We need all kinds of prevention along the continuum for really a comprehensive approach. But I do think that one of the silver linings of this pandemic is we're seeing public health in action, right? Many of us, public health is very abstract. How do we measure prevention, right? It's much easier to measure lives saved from downstream approaches than people that never got the ailment to begin with, right? So that's always a struggle in this field, or in, the concept of prevention. But I do think that there's more and more champions for prevention, people that finally learn about it and say, oh, of course that makes sense, that we want to help people before they find themselves in crisis. And we find that we're able to do that more at a community level, family resource centers, other things that are just available in the community without stigma, without, having to be mandated to attend it, to be voluntary, that you don't, as we lift up more of these community-based solutions for prevention, I think we're going to see more people take part in those prevention solutions too. So I think I'm so thankful for this opportunity to kind of continue to raise awareness for primary prevention of child abuse and neglect, certainly. But really what I think we're doing is trying to assure the best possible physical and mental health of our children and families for generations to come.
This is such a great conversation that I want to make sure we actually have a few minutes to get other people into it. And there are a number of questions coming in already through the chat that people are saying, could you please ask about this? Could you please ask about that? So let me throw in kind of two at once here and give you a chance to react to these. One is the undeniable importance of teachers in the fight against child abuse and neglect. And the other piece of this is, what about therapists? How can therapists work to prevent child abuse, considering often where they come into an individual situation? So teachers and therapists, take it away.
Thank you, Paul, and thanks everyone for those great questions. First of all, I believe, and I think I've said it multiple times in this conversation, that we all have a role to play. So it doesn't matter what discipline, what your job is. Many of us wear multiple hats. You may wear a parent hat, a community member hat, a church person hat, a therapist, a teacher, a businessman, and we all have some part of this prevention comprehensive approach, right? But teachers, of course, are undeniable, their impact in the lives of our children and families every day. And, I think what I've seen, and I want to address directly, what I've seen in the last 6 months or so is a lot of popular media stories really saying, oh, we're scared for kids because they're not in school, so their teachers can't see if they're being harmed. Okay. Yes, teachers and many other professionals are mandated reporters, and they do identify risk early and often in children's lives. But they have a more proactive prevention role too. And they, in that way, Prevent Child Abuse executive director in Arizona for our Arizona chapter, her name is Claire Luge, and she talks about, what about if we've reframed that to mandated supporters instead of mandated reporters, right? Recognizing already the role teachers play in that emotional connectedness piece, being able to realize the needs in a family, in a student's home, and can connect, to services and such. Of course, I think that we rely on teachers to do a whole host of jobs, and we are just so thankful for teachers in this moment. But teachers can have a role in primary prevention too, and I think we sometimes don't see them as primary prevention agents. Therapists too. Again, trained as a clinical psychologist myself. I will say during my time at CDC, we developed, in partnership with the American Psychological Association, an online ACE training for what is the role of behavioral health practitioners and psychologists in primary prevention, because we do sometimes default and see our role as understanding trauma after the fact. But really, as we know from a robust intake, we can understand all the risk factors, but we also need to really understand what protective factors exist in a family, in a community, in a child's life, and help to boost those. So really, we are seeing families for a whole host of reasons, but we can also be good assessors of risk and protection and help, again, tip that balance. It's about starting our young people on a trajectory towards health and well-being. And, we just tagged a new tagline for Prevent Child Abuse America that says, Prevent Child Abuse America, because childhood lasts a lifetime. And that is so, to me, powerful, because it's aligned with the science on brain development and epigenetics and development. But it also says that childhood, positive or negative, it will stay with us. So how do we make it the most strong and protective childhood with safe, stable, nurturing relationships and environments? And absolutely, teachers and therapists and all of us have a role to play in that.
So what about all of us then? So another questions come in about the average citizen, somebody who's not trained as a teacher, not trained as a therapist, and they'd love to hear a specific example or two. So on the one side, how do they help prevent child abuse? And on the other side, what are a couple of the things that if somebody had to do them or could do them every single day to be able to be supportive for their kids or kids in the neighborhood, that you would say, do these two things? So both sides of that. What about the prevention side, and what about the promotion side?
Supporting each other. I mean, again, in this moment of physical distancing, it is more important than ever that we remain socially and emotionally connected to our communities, to our neighbors, to our families. Obviously, it takes on a different tone these days that we're not able to physically be in person oftentimes, but on walks around your neighborhood, really, these are simple things that we all can do, but waving, smiling, saying, hey, good to see you. Isn't it a beautiful day? Striking up conversation. If you're able to give food to your food banks locally. I mean, we know that diapers, data, and devices are so important for families right now in terms of accessing home visitation services and such. So there are small things that we can all do to promote this, well-being culture, if you will. And so I think that parents too, I think we need to recognize the real value in self-care, that our kids are learning and they experience their world through the relationships they have with parents. And so if we're doing better, our children will also be doing better. It's also, I think important to highlight that kids are resilient. So, as much as parents are struggling right now, and we all are struggling, but as much as we can take time, whether it's a minute outside to take a deep breath, whether it's, reading a book or exercising if you're into that, whatever makes you self-regulated and helps you take a moment, take a pause, your kids will learn. They will learn their own coping skills from parents, of course. And so I just think that there's so much, just these small things, they add up. Just like ACEs can add up. I'm going to lift up in Tennessee, they use their ACE acronym to say all children excel, to really be that strengths-based focus instead of just risk reduction. So there's so much that we can all be doing to promote the protective factors, protective relationships, environments, contexts. We all have a role to play.
Well, and I love that approach of, somebody asking the question, what can we do for our kids? And you come back to, it's also what we should do for ourselves. If we take care of ourselves, it's such a simple concept. We take care of our kids, and we actually help our kids carry taking care of themselves from childhood to adulthood. So we also build a generation that will become more resilient. I think a lot of people might be enlightened by that because it is so simple and so easy to do and so easy to forget when we're stressed and our kids are stressed and we're just trying to fix it.
we don't always give ourselves permission, to take that moment, to take that time. We think it's, taking away time from our kids or such. We have lots of, I know I experience a lot of mommy guilt, right? Or working mom guilt. We have all these things piling up, and sometimes it can feel like, oh, yet another thing. But it's so important that we stay self-regulated, that we put our own mental and physical health at the forefront so that our children can also regulate.
You've had a lot of background in policy related work, and we've got a question that somebody's raised saying, prevention still isn't the go-to in our health system. So how do we change it? What do you think are some of the most persuasive things that we can do in order to change this? And what are the opportunities we have today?
Yeah, well, I think it's really important that we continue putting out studies on return on investment, and those dollar figures that policymakers really, they resonate with policymakers. So things like the vital signs that CDC released, that really say, again, if you prevent ACEs, you could prevent 44% of adult depression, and then put a cost estimate on that. How much does that cost our system, our society, and how much, if we invested in prevention, could we realize in downstream savings, right? So I think it's cost studies are super important and still kind of a gap in the field. I think it's also norms change approaches, right? Again, we still have this dominant narrative that we have to change. We have to change to say we all have a role to play. We all benefit if everyone is doing better. Again, healthier kids lead to healthier adults, lead to healthier parents, more prosperity, more productivity. I mean, it's as simple as that. We want our kids to be as healthy and strong and mentally well as possible so that they could go on and realize their maximum health and life potential. I think, these policy solutions like providing economic supports for families, earned income tax credit has a lot of evidence for preventing child abuse and neglect perpetration. So too does livable wage. Dollar increases in livable wage result in 10% reductions in child neglect. I mean, these studies are happening. We know that there are policy solutions, but again, it's around us all understanding that prevention is possible. It is not that this is the inevitable outcome for our kids and families. We want better for our kids and families than we experienced, right? So every generation wants improvement in health and prosperity and well-being. So how do we have our true values and norms reflected in our policies? Vote, vote, vote. That's for sure. Stay active in your communities. Recognize that you all have multiple hats that you're wearing. And so how can you really help change the dialogue, change the narrative in this country that we all do better if we're all doing better?
Yeah, and one of the things that I think, we end up getting stuck with in some ways is the need to explain costs as investments. I often think that the prison system never had to talk about what a great investment it was to build out the prison system that we've built out, because it wasn't. It was a cost that was associated with bad policy decisions that were made, 30 years ago when we closed state hospitals and when we put determinate sentencing in and did a whole lot of other things that were inappropriate. And even a lot of the road improvement people aren't really talking about the great investments that we're making when we change an entrance ramp or change an exit ramp to accommodate a new highway. And yet we've got to talk investments all the time. Does it ever bother you that we can't just say to people, this is just worth it because it's improving your life? Like eating food is worth it. Having health is worth it. Being able to get from place to place is worth it. And that's my pet peeve. How about you?
Yeah, does it bother me? Absolutely. But I also think that if you're a champion in this area, you don't care how you have to say it, how you who you have to get to listen, right? You change your message depending on the values of the people that you're talking to, right? So if I'm talking to chambers of commerce on why they should invest in primary prevention in their communities, I am talking about dollars, right? If I'm talking with someone who's a mental health advocate, then I don't have to sell it in that way, right? And so yes, it's troubling that we have to go there, but the truth is, no matter what data you look at, you see that there's great benefit in investing in children and families and keeping families strong and together and thriving. We can measure it however you want. It's better than what we currently have. So we can't do what we've always done, because then we'll have what we have, right? Which is a tremendous still public health crisis in early adversity. But prevention is just as urgent and is just as possible. And together we can prevent child abuse.
Well, that is a great message of hope, which was going to be my last question. And we have literally about 60 seconds to go. So we've got a chance to answer something perhaps from the audience again. And that was, people are looking for book recommendations or article recommendations just to learn more about, I think, ACEs and more about some of the positive things you've been saying. If you could focus on one or two or three, where would you tell people to go to get some more reading material about this?
Sure. Well, certainly you can come to the Prevent Child Abuse America website. That's Prevent Child Abuse America, or PCAamerica.org. I should know our own website. CDC has a wonderful ACEs repository of key articles, seminal articles. I think if you can only read one article, the vital signs that came out late last year. If you Google ACEs, vital signs, CDC, it'll come up. I'm the first author on that paper, but I think it's really nice because it goes across leading causes of death and morbidity and the associations with ACEs. I also just think there are terrific books. I have a book on my shelf here, The Color of Law. This is a book not about psychology or about child maltreatment. It's really just about our history of policies and structural and social determinants of health, and how many of our policies were designed to get the outcomes that we get, right? And so then if we make our work about redesigning our policies, our systems, we can get different outcomes. So I think those are ones that come top of mind, but certainly CDC has a wealth of information. There's so many pioneers in this area. Certainly, if you're interested in the neurodevelopment aspects, I would Harvard Center for the Developing Child has a wonderful platform. Also, Dr. Bruce Perry's work is tremendous. He's one of our board members at PCA America. But there's a lot of reading to do. But I will say that it's clear across all literatures, all anything that I know about, that we can prevent child abuse if we work together across sector, across discipline, across silos. If we break those silos and truly put the health and well-being of our children and families at the forefront, we can achieve multiple public health goals.
Thank you. Thank you, Melissa. On that note, we're going to have to end this and move on. We really appreciate you taking this time.